of surviving internal medicine is knowing your pathology and pharmacology. Should be good in pathology and pharmacology. You'll survive in internal medicine. Let's say you have a patient who is on simvastatin. I'll know this patient is treating hyperlipidemia. If my patient is on metformin, automatically know he's treating diabetes type 2. If my patient is on Ozempic, I will know that the patient is treating diabetes, which is associated with obesity. Is trying to reduce weight in order to improve the diabetes symptoms. If I have a patient who is on Eliquis, which is an antiplatelet, I'll know the patient is trying to prevent blood clots from forming, which might put the patient on risk of developing strokes. So Eliquis is an antiplatelet. If I have a patient who is on Losartan, I know this patient is trying to treat hypertension. If I have a patient who is on Tramadol and Miralax, I know that Tramadol is an opioid and they can cause constipation. So Miralax is there to counter the side effect of opioid, which is constipation. If I have a patient who is on pantoprazole, I'll know this patient has some sort of GI problems, maybe GI bleeding. So pantoprazole is used to help to prevent GI bleeding. If I have a patient who is on Suboxone, this is a patient who is trying to battle opioid dependence or opioid addiction. So some of the most conditions that I've seen, hypertension, you won't miss that, obesity, hyperlipidemia, diabetes, arthritis, and then there's asthma, COPD, and low back pain. Those are the common conditions I've seen in internal medicine so far.